Good morning. I'm Lauren Regani, a media officer with the National Academies. I'd like to welcome those of you in the room and those watching the webcast to today's public briefing to release a new report, Epilepsy Across the Spectrum, Promoting Health and Understanding, from the Institute of Medicine's Board on Health Sciences Policy. The report and related materials are available online at www.iom.edu/epilepsy and at www.nationalacademies.org. After some brief introduction of the committee members who have joined us today, our panel will provide an overview of the report's key points. Then we will open the floor to your questions. We ask those of you in the room to step to a microphone on either side of the room to ask your questions. Webcast listeners can submit questions at any time during the briefing via email. We ask everyone to be sure to identify yourself and your organization when asking your question. The briefing will last approximately 1 hour. IOM will be tweeting during the event, and you can join the conversation on Twitter using the hashtag #IOMEpilepsy. In addition, to test your knowledge about epilepsy, the IOM developed a short quiz based on this report that can also be found at www.iom.edu/epilepsy. We encourage you to take the quiz and share it with your friends and colleagues. And now I'd like to begin by introducing Dr. David Feinberg, President of the Institute of Medicine.
Thank you very much, Lauren, and good morning, everyone. It's my privilege and pleasure to welcome all of you to this briefing on our new report, Epilepsy Across the Spectrum, Promoting Health and Understanding. This is a problem, I was just talking with our Assistant Secretary for Health, Howard Koh, that is remarkably hidden for such a visible illness. Epilepsy is among the most common neurological conditions. It affects millions of people. And because of the way it expresses itself symptomatically, it can also provoke fear, misunderstanding, stigma, social isolation, employment difficulties, and even early mortality. It's a very serious problem that has been too long neglected as a public health concern. And we hope that this report will begin to change the way in which we, as a nation, come to understand, embrace, deal with, and solve the problem of epilepsy. This report is not about basic biomedical research. There's a wonderful plan and program that the National Institute of Neurological Diseases and Stroke has developed over more than a decade, periodically updated, that deals with biomedical research. Instead, the committee that we brought together to undertake this task was asked to come to grips with the public health dimensions of the problem. And they dealt with 4 aspects. They dealt with the issue of surveillance and the collection, analysis, and use of data that's related to epilepsy. Secondly, they dealt with the issues of population-based research and understanding of the problem as it expresses as a public health concern. They focused third on issues of policy, health care, and human services that are needed for patients, families, and communities coping with epilepsy. And finally, they dealt specifically with the needs for education of patients, communities, families, and health providers. One of the most striking things about this effort to me is that more than 20 sponsors joined in undertaking and supporting this work from the public sector and the private sector. And it's very indicative, I think, of the kind of public-private partnership that is going to be needed from this time forward to convert the ideas and recommendations that the committee has developed into real change in the lives of individuals and families and the way our nation can deal with the problem of epilepsy. I'm so appreciative to the committee who, as you know, as volunteers, come together and work so well and assiduously in developing this report. I want to express my appreciation also to our staff, who really supported this effort in a most concerted and dedicated way. Everyone, I think it's fair to say, learned something in the course of this effort. And together, I believe we now have a blueprint that can help propel action and success. I have now the pleasure to introduce the chair of the committee, who in turn will introduce her colleagues who are with her on the panel to introduce an overview of the report, after which we'll have an opportunity for questions and answers with all those who are here and those who are listening on the web. The chair of the study, Dr. Mary Jane England, currently serves as visiting professor of health policy and management at the Boston University School of Public Health. I am a longtime admirer of Dr. England, seen her in many important public health roles, and I am so appreciative to her for her leadership on behalf of the committee that dealt with this problem. Thank you, Mary Jane, and now the floor is yours.
Thank you, Dr. Feinberg, and welcome everybody. We are very excited about the report we will be sharing with you today. We are grateful for many of the issues that Dr. Feinberg suggested, the public-private partnership, the leadership shown by the groups that came together and requested for the Institute of Medicine that we do this report. We're also particularly honored in the sense that we think in many ways our report could be a model for the way we manage most chronic illnesses as we move forward, the public-private, the solutions through the Accountable Care Act, and all of the other kinds of issues that I think all of us are grappling with at the federal, but also at the state and local levels. So we are very excited about this report today, and I'd like to introduce to you the committee members that are going to be sharing with you some of the recommendations. The first committee member is Chuck Begley, who is a professor of management and policy sciences and co-director of the Center for Health Services at the University of Texas Health Science Center in Houston. We also have Christy Heck, who is the director of the University of Southern California's Adult Comprehensive Epilepsy Program, and Joan Austin, who is the distinguished professor emerita at the Indiana University School of Nursing in Indianapolis and a member of the IOM. We also have two committee members that we had a great committee. We had a great time. We learned to work very closely together, and we learned a lot from each other, and hopefully you'll see that within our report. The first is Sandra Kushner-Weinstein, who is the Director of Services and Camps in the Center for Neuroscience and Behavioral Medicine at the Children's National Medical Center in Washington, D.C., and we learned a lot about camps. Thank you very much. And Joe Servin, who is the Professor of Neurology and Chair of the Department of Neurology at the College of Medicine of the Mayo Clinic in Arizona. Thank you, Joe, for being with us today. And I'm going to start so that we can move right along with our program here. We can't see the, I guess I can see them down there, Judy, is that right, when I move them? Oh, good, thank you. So we're going to start to tell you about epilepsy across the spectrum, promoting health and understanding, and this is focused on the public health dimensions of the epilepsies. The IOM committee, as you can see, was very diverse, represented many professionals from different levels, and also patients afflicted with epilepsy. Our study sponsors is probably the most exciting part, that we brought that the public and private sector came together to ask the IOM to do this. The leadership from Dr. Coe at the HHS and across the HHS, as as CDC and the other public agencies as well as the private agencies. It's very exciting. And we look forward to actually working with them to continue. This is just the beginning. This program is not going to sit on a shelf. We're going to get going, and we're going to make a difference. And for those of you who are in Washington, you know there'll be a march tomorrow for epilepsy, and I would, for those of you who are around, I think that's a great idea I know Christy brought her daughter and her daughter's friend to be in the march. So on to our task. The IOM committee was asked to conduct a study and prepare a report to recommend priorities in public health, healthcare, and human services, and focus also on health literacy and public awareness for the epilepsies. We know a major problem in healthcare are those issues, and to propose strategies to address these priorities. So as was mentioned earlier, the study focused on public health surveillance, collection, and data integration, population and public health research, health policy, healthcare, human services, and patient, provider, and public education. We did this in a pretty short span of time. Our timeline our first committee meeting was in January of 2011, and by November of 2011, we had our recommendations. That doesn't mean there wasn't a lot of work done beforehand by staff, and I can't say enough. And thank you, Dr. Feinberg, for your excellent staff here, and Dr. Pope as well for the work that was done here by the staff. They're terrific. And then, of course, following our recommendations, you know, the IOM does a very intensive analysis of the report and the recommendations to make sure it's based in science, to make sure it's based in reality, so to speak. And that report review went very smoothly. And we wanted to release this report at the same time as the epilepsy community was coming together in Washington, so that we are on target. And again, good timing and a quick review. Now, let me just talk a little bit about epilepsy and the definition. For most of you in the room, you know the definition, but it's surprising with something like this that very few people actually understand what the definition of epilepsy is. What is it? Well, we tried to lay it out somewhat in the report, so it is there in more detail. But where the definition we've come to is that seizures, disturbances in the electrical activity of the brain, that there are 2 or more unprovoked seizures separated by at least 24 hours. And probably the focus that we've taken the most is that epilepsy is a spectrum of disorders. It's not just one thing. There are many different types of seizures. There are many causes of seizures. And so there are many syndromes and types of epilepsy. And as we get talking, we'll show you how there's a spectrum then of response as well. We feel strongly that some of the terminology continues the stigma. And we would like to recommend that the term epileptic should be discontinued because it has tremendous negative connotations. The committee suggests using terms such as seizure medication rather than anti-epileptic, and epilepsy seizures to replace epileptic seizures. I think increasingly, as we understand more and more about communications, we know how impactful those words can be. And we've talked to patients with epilepsy, and they have shared this with us. So we feel that's an important recommendation, just in the kind of base of the way we talk about this particular area. The magnitude, 2.2 million people in the United States and more than 65 million people worldwide have epilepsy. There are 150,000 new cases of epilepsy in the United States annually, and 1 in 26 people in the United States will develop epilepsy at some point in their lifetime. Children and older adults are the fastest growing segments of the population with new cases of epilepsy. And I'd like to focus that most people think about it as a child and young adults. They don't understand the tremendous increase in older adults. So we will be talking about that as well. Epilepsy is the 4th most common neurological disorder in the United States after migraine, stroke, and Alzheimer's. So it has major impact on our communities and on our patient populations. There are many cross-cutting themes. It's a common, but it's a very complex neurological disorder. And as was mentioned earlier, it affects the whole quality of life. The effective treatments are available, but access falls far short. There are barriers to getting appropriate care. Data is needed to improve epilepsy knowledge and care and to inform policy. We need to strengthen health professionals' education, an area that we are very concerned about and we'll speak to as well. We need to bolster the education efforts for people with epilepsies and their families and in communities. And we need to all work together to eliminate stigma. The stigma that, in many ways, the prejudices that get in the way of people having adequate education, adequate employment, and their ability to function in community at large. I would now like to turn to Chuck, who will walk us through the next few slides. Chuck.
Thank you, Mary Jane. You know, I just like the word spectrum. Thank you, Mary Jane. I just like the word spectrum in the title of the report, because I know that originally we were thinking of it in terms of the representation of the spectrum of conditions that epilepsies represent, and in terms of the variety of issues that are raised. But it's also a good term for the report, because this is a comprehensive report that deals with a spectrum of issues ranging from data to healthcare services to psychosocial services to educational issues. So what I would like to do to get us started on this is try to give you a brief synopsis of what our group did with respect to data. And this is on this first slide, where what we basically tried to do was to identify the gaps in knowledge or understanding that we have on the basic incidence and prevalence of epilepsy, the burden of epilepsy, the impact, the healthcare services for epilepsy, and outcomes. And we identified a series of gaps that are basically in two broad areas. One is that the data that we do have from our surveillance is not of the highest quality. There are lots of limitations, and we have lots of variability in some of our estimates that needs to be cleared up. Secondly, we simply do not have enough surveillance going on. We have lots of issues in terms of subgroups of the population affected by this condition and types of services and outcomes that we simply are not monitoring at all. So those are the two issues that we identified are issue areas. And what we have is a couple of recommendations, broad recommendations with different components to them. Recommendation 1 on this slide we're asking for the Centers for Disease Control, in collaboration with other professional organizations and other federal agencies, to work together to fund demonstration projects, to figure out how to develop good measures that are validated and standardized for identifying cases and service use and costs and quality of life issues. We are also asking for, beyond the validation effort, to get into some dissemination and adoption strategies for ensuring that the work that does get done in terms of developing good measures gets implemented. That's recommendation 1. Recommendation 2, it speaks to the issue of the need for more surveillance. And we've tried to come up with a realistic and practical list of challenges for us to get going on how to do this. And it calls for a series of activities that are, some of which are not going on now, and some of which are going on and need to be expanded. We applaud the Centers for Disease Control for the amount of effort that's already going on in this area, and we ask them to lead further into this, to get into a range of issues that are listed there in this slide, that range from getting more complete questions on national population surveys to exploring linkages in newly emerging data collection using electronic health records, to including epilepsy data in existing and future longitudinal studies. So those are our recommendations with respect to data quality and the need for more public health surveillance in epilepsy. The next chapter that our group worked on was reflected by this slide in prevention of epilepsy. What we were looking at here was the gaps in our understanding of risk factors, of comorbidities, of outcomes in epilepsy that would, if we understood them better, would lead us, indicate some areas that are very ripe for prevention, either primary or secondary prevention. And what we found in this area were, again, two types of issues. One with respect to our understanding, the need for more research on these risk factors, and two, that we have a good knowledge of the risk factors for some of our conditions, and there is a need for more action on reducing the risk factors. So our recommendation 3 speaks to the need for more action. And you see there that we're asking, again, a partnership of stakeholders to develop and evaluate prevention strategies ranging from preventing neurocysticercosis infections to reducing felt stigma. We think these are, based on the experts and literature that we reviewed, the ones that are most ripe for action that could be very beneficial at the present time. We don't have, on the additional research that's needed, we don't have a specific recommendation. There is a chapter at the end of the report where we have our research priorities, and we have a list of research priorities from this chapter that would help us get down the road towards a deeper understanding of those risk factors for the future. So that's what we did in, I think this is chapters 2 and 3. Tried to give you a brief synopsis of the problem areas and recommendations and strategies that were suggested there. And I'll turn it now over to my colleague, Christy, who is going to move us into the healthcare area.
Good morning, everyone. My task is to discuss healthcare access as well as education of health professionals. The next slide addresses improving healthcare. While significant progress has been made in treating some types of epilepsy, much remains to be done to improve quality, access, and value of health care for people with epilepsy. There are gaps that have been discovered through this IOM process, which include delays in diagnosis and referral, disparities in the access to care for underserved and rural patients, and challenges in co-management of those patients between primary care and specialty providers. So this leads to recommendation 4. The committee asks that in order to improve the early identification of epilepsy and its comorbid health conditions, that the American Epilepsy Society and the American Academy of Neurology lead a collaborative effort with a wide range of relevant federal agencies and professional organizations to develop and validate screening tests for early identification of epilepsy in at-risk populations, establish and disseminate a standard screening protocol for comorbidities with currently approved screening tests that already exist, and establish and disseminate a screening tool for early identification of patients with persistent seizures to lead them to earlier referrals to epileptologists or epilepsy specialists. The committee's recommendation number 5 addresses a national quality measurement and improvement strategy. The American Epilepsy Society, in conjunction with other professional organizations, should initiate the development of a national quality measurement and improvement strategy for care of epilepsy patients. The strategy should develop and implement a plan to disseminate existing clinical guidelines. It should define performance metrics for epilepsy care. It should continue the implementation of a set of performance metrics that includes patient-generated measures, and it should conduct demonstration projects to validate those performance metrics. And then recommendation 6 is the establishment of accreditation of epilepsy centers and an epilepsy care network. The committee is suggesting or recommending that the National Association of Epilepsy Centers and the American Epilepsy Society collaborate with relevant organizations to establish accreditation criteria and processes with independent external review mechanisms for accreditation of epilepsy centers. Accredited epilepsy centers should work together to form an epilepsy care network to include data sharing, clinical trial and other research networking, professional education, and other collaborative activities. Then we move on to the education of health professionals. We found gaps exist in health professionals' knowledge and skills in how to treat and care for people with epilepsy and its associated health conditions. This leads to recommendation 7, to improve health professional education about the epilepsies. The American Epilepsy Society and the American Academy of Neurology should collaborate with relevant organizations to ensure that health professionals are sufficiently knowledgeable and skilled. The organizations should define essential epilepsy knowledge and skills, conduct surveys to identify knowledge gaps, evaluate existing materials and learning opportunities, develop interactive materials and tools for integration into existing curricula and programs, ensure that materials and programs reflect current research, explore and promote the use of innovative interdisciplinary approaches, and disseminate educational materials and tools widely. I'll pass the microphone on to Joan.
Thank you. I will be presenting recommendations in 3 areas: quality of life, education, and public awareness. The first area is quality of life. Living with epilepsy is about much more than having seizures. For people with epilepsy, the disorder is often defined in practical terms, such as challenges at school, uncertainties about social and employment situations, limitations on driving a car, and sometimes there's questions about living independently. At the same time, people with epilepsy are faced with health care and community services that are often fragmented, uncoordinated, and difficult to obtain. To improve the delivery and coordination of community services, the committee is recommending that the CDC and other epilepsy organizations partner with these community service providers and epilepsy centers to enhance and make widely available educational and community services. Specific attention should be given to identifying the needs and improving services for underserved populations. These efforts should link people to local and regional resources, develop innovative partnerships with organizations for related disorders, conduct pilot studies of interventions, maintain effective transportation, employment, and housing programs, identify the evidence-based best practices in employment programs, develop best practices for coordination of healthcare and community services, provide a 24/7 non-medical helpline for families to call, and develop educational opportunities for community service providers. The second area is on education. Education helps people with epilepsy and their families to adapt to life with epilepsy, to develop self-confidence, and to competently manage the disorder and the other associated conditions or comorbidities. However, access to resources and programs that are accurate, up-to-date, easy to understand, and linguistically and culturally appropriate is inconsistent. So to ensure that people with epilepsy and their families have access to this accurate, clearly communicated educational materials and information, the committee recommends that the epilepsy organizations should evaluate the epilepsy websites and their educational resources, develop a central website with links to online resources, ensure that the resources are up to date and reflect current science, engage people with epilepsy in the development of these online resources, support the development and use of self-management and educational programs, engage the Epilepsy Foundation affiliates, the epilepsy centers, healthcare systems, and providers in the dissemination and of resources and self-management tools, and explore the development of a certificate program for epilepsy educators. In the third area is public awareness. Public misperceptions and misinformation about epilepsy have persisted over centuries and continue to exist. Stigma and internalized fears of discrimination and prejudice affect the quality of life of people with epilepsy. So to improve public knowledge and to combat stigma, the committee recommends that the Centers for Disease Control and the other Vision 2020 organizations support and bolster programs that provide information to the media. Efforts should promote frequent, accurate, and positive storylines about characters with epilepsy. Encourage high-profile individuals who have epilepsy to speak openly. Establish partnerships with stakeholders that represent related conditions that also have a stigma. Continue to work with the media on news and human interest stories about epilepsy, and disseminate regular updates on research and medical advances to journalists and policymakers. The second recommendation in this area is related to public awareness. It focuses on the coordination of efforts. The committee recommends that the Epilepsy Foundation and the Centers for Disease Control lead a collaborative effort with relevant organizations to educate the public through awareness efforts, promotional events, such as this weekend, and educational materials. They should establish an advisory council, develop shared messaging that emphasizes the common and the complex nature of the epilepsies. Explore the feasibility of an ongoing, coordinated, large-scale, multimedia, multi-platform, sustainable public awareness campaign, and ensure that all awareness campaigns include consideration of health literacy, cultural appropriateness, and the demographics of the target audiences. They also include rigorous research and testing throughout the campaign and appropriate and evaluation and follow-up after those campaigns. I'll now turn it back to Dr. England.
Thank you to all three of you. Those were very interesting, and I think we'll have some opportunity for discussion when I follow my presentation. The next area that we focused on was strengthening stakeholder collaboration, and I want to thank all of you who were part of our public hearings as we went both here in DC and across to LA to come and tell us about your personal experiences with people with epilepsy and your involvement when we needed you. So I think the importance of strengthening stakeholder collaboration is really an important area. Certainly epilepsy advocacy and research organizations, as well as continuing with the government agencies, you've already started, and we need to create this strong voice, a united voice for change, get our act together, so to speak, and to advance research and then improve the healthcare and human services for people with epilepsy and for their families. Thank you very much. Our recommendation 12 is to continue and expand the Vision 2020 working groups and collaborative partnerships. The members of the Vision 2020, it's terrific what they have done. They should continue their efforts and expand their ongoing working groups that communicate regularly and identify common goals and develop strategic plans, and when possible, carry out joint activities. And I guess we'll be meeting with some of you this afternoon, and we look forward to that. The working group should focus on health policy, health reform, and advocacy. Couldn't be a better time. Surveillance and epidemiological and health services research, healthcare and community resources and services, the education, as you've heard, for health professionals, and education of people with epilepsy and their families. The next area that we have focused on is engaging people with epilepsy and their families. Probably the most persuasive advocates, whether it's here in Washington or across its state capitals, are persons with epilepsy and their families who are willing to speak out to provide a more complete picture of the disorder and its impact. We feel strongly that we need to engage in education, dissemination, and advocacy for improved epilepsy care and services. There is a lot of ignorance, a lot of misinformation, and people with epilepsy and their families should, to the extent possible, discuss best options of care with their healthcare providers. Consider participation in research. Engage with community professionals to educate them about epilepsy and ensure that needed services and accommodations are provided. They need to talk openly when possible about epilepsy and its impact on life. A good example is children that are now in our special education programs are now being taught more and more to speak up about their disability. It's a big change in what we've seen in the past, and so we need to get our people with epilepsy and their families to talk openly and to actively participate in support networks and to work with nonprofit organizations to raise awareness and to participate in advocacy efforts. I want to thank all of you again for the opportunity to lead this very important committee, and for my committee members, as well as the leadership of the federal and both public and private agencies that have been involved, as well as the leadership from the Institute of Medicine. It has been a very important, I think, contribution as we move forward, and it is now time to take questions. I have a couple of things that I'd like to kind of talk about in taking questions, and we will attempt to answer them. Is that when you come to the microphone, if you would be kind enough to introduce yourself, and if you could, as succinctly as possible, ask your question so that we can answer it. In fairness to all, I will cut you off if you, I know there's passion in the room, and I agree with it, but we need to move this along. So I will take the prerogative as the chair to cut you off if I feel that we're just kind of moving too far down the road and not clear enough. Before I open it up to the general public, I would like to ask if our two committee members have anything they wish to add. You all set? Okay. All right, and I think I will turn to our first question. Please introduce yourself and let us know what your question is.
I'm Peggy Eastman with Neurology Today newspaper, and I'd like to ask for a few more details about how the epilepsy centers would work. Would they be similar to the cancer centers, specialized cancer centers, and the stroke centers? And what sort of criteria would be needed to become an epilepsy center?
There was a lot of discussion about the concept of epilepsy center certification. We felt that it was extremely important for the discipline in terms of care of epilepsy patients to have consistency across the country with respect to how we approach patients with epilepsy. And we felt that it was not our place to give specifics about what the certification should look like or who the external body for review should be. I think there are we think that there are plenty of models out there, including the stroke centers as well as cancer centers, for which we can model these centers as we think they will work best. But I think at this point, our goal was to demonstrate that it is necessary to make all of these centers accountable and clearly identifiable for patients as to what they should expect when they enter them, and also to bolster referrals for those patients that it is appropriate to refer.
Are there any other questions? Okay.
Go ahead.
My name is Solomon Moshe. I'm the president of the International League Against Epilepsy. I do not have a question. I have a comment. I would like to thank you very much for this outstanding report that we think that has merits far beyond what we do here in the U.S. It can be used in all the other regions of the world. So I take this opportunity to thank you for an outstanding work. Thanks.
Well, we thank you.
I'm Leslie Marqua, and I'm the Executive Director of Dravet.org. We are, of course, one of the sponsors of this report, and we're very pleased with the work that you've done, and thank you for your efforts. I understand that the scope of your work did not include a fiscal analysis, but you proposed a great many things here, and I'm wondering if in your conversations you gave some thought and perhaps did some tallying on the back of an envelope as to what all of these initiatives would cost. That would be the first part of my question. The second part of my question is, who do you envision paying for this? And the answer, the federal government, is probably not a complete answer.
We don't have a tally on the back of a napkin to tell you what the cost of these initiatives would be. We see it as a collaborative effort for patients and people with chronic illnesses. There are a lot of changes within the healthcare system. If we were to implement some of the changes we currently see, there would be savings that could then, with care management and other kinds of approaches, be good for people with epilepsy, as well as people with mental illness and substance use, as well as people with chronic illnesses. So we see that healthcare needs to be rethought with community involvement. And we have not settled, so to speak, on a particular dollar amount that each federal agency might need or each local community, because we think there are ways as we move forward to have certain savings that can be moved across people with chronic, particularly within our people with epilepsy and other chronic illnesses.
Thank you. And one final question, given that nobody else seems to be standing up. If there were to be one single takeaway from this morning, what's the one thing you would want us to remember?
That it's a complicated spectrum, that it impacts children, but it also is growing very rapidly in senior citizens, and that we have solutions, and we need to come together as public-private communities to work with people with epilepsy, their families, and the communities to make this report a reality.
Yes, this is Frances Jensen. I'm current president of the American Epilepsy Society and also had the privilege of helping steer the Vision 2020 group of private and public partnership organizations. And like the last question, I think that the next challenge, of course, is what do we do? Where are we going to go? You have given us a roadmap, a blueprint, a charge, our marching orders, and we're ready, to accept those as a community. I think we're looking forward to maintaining our relationships between the healthcare provider organizations and professionals, as well as the epilepsy community and patient organizations, in working very closely with who the Institute of Medicine directs us to work with to move into this next phase to actually enable a functional operation moving forward. I think we are ready. We want to even start this spring. As soon as this is out in the next month, we actually want to implement some of these ideas and get some organization amongst us directed in this new for these new targets. So we are ready and able and willing, and we just want to send that message to everybody here. Thank you.
Well, thank you, Dr. Jensen. It would be fair to say that I think all of us that work with the IOM and with our committee reports want that kind of support. We don't want this to be put aside. We've done a lot of good work. We want to continue to work with you and the partnerships on 2020 and move this forward. I think that's what I think the mission of IOM is, not just to provide reports, but to make sure that we move the whole thing forward. So we thank you very much. So on behalf of IOM, thank you for your comments. Susan?
Hi, I'm Susan Axelrod with Citizens United for Research in Epilepsy, better known in this community anyways, CURE. I want to thank you, add my thanks too, for an unprecedented and amazing analysis of the situation. I don't think any of us who live with epilepsy or have worked with epilepsy take issue with any of your recommendations, so I want to thank you for those. And I have two questions if I can. One is clarification, and I think it is probably a little more poignant to ask this question today, given the tremendous press that the autism community received yesterday with their prevalence figures. And I've asked this before, but I thought to the extent that press might be listening, it would be interesting to hear your explanation of the 2.2 million, which came across as a pretty definitive prevalence figure for epilepsy, while at the same time, and I think this is a direct quote, you say we are flying blind in terms of our surveillance efforts. So that's question number one.
Chuck, you're on.
Thank you for that question. It's a great question. Where we got that estimate is that we took what we thought was the most scientifically defensible recent literature survey article on the epidemiology of epilepsy, which generated an estimate of prevalence of about 7.1 people per 1,000 population. We took that figure and age adjusted it, multiplied it by the 2012 population to get the latest estimate to come, and that comes up with the 2.2 million. We look around and we see that in the epilepsy community, figures that are being used there range from 2 million to 3 million. And so all I can say is that this variation that we have out there in the community reflects the reasons for Chapter 2 and 3. That we need better surveillance, that we need better data so that, a year from now, 2 years from now, 3 years from now, we'll be able to all settle on a figure and that we think is the figure that we're most comfortable with. But right now, it actually ranges from 2 to 3.
Susan, would you like to continue? You said you had a second question.
Yes, the second question is about a particular population, which I think was addressed in the report, but not today, and that is our returning veterans who are at high risk, and if you have any recommendations about surveillance, care, ongoing care for that community.
I'll start by saying, again, in the report being a roadmap, we have identified that population as one of the high-risk populations for which focused research and data collection are needed, and for which there's a lot of potential for prevention, and made some specific recommendations about how to pursue that agenda. At this point, we have no specific strategies, but we certainly have prioritized that population in the report.
Susan, I think, again, your question is a good one, and I think this is an opportunity with the multitude of problems that our veterans are returning home with, that this is a time for a coordinated approach to their needs, whether it's post-traumatic stress disorder, whether it's different brain disorders. We had some public testimony during one of our hearings. I think this is a good example of where we need to get together to come up with a program for how to manage the transition as well of these vets back home. The problem dealing with families, with intimacy. There's a lot of very complicated issues that I think we as a country have a responsibility to address. And so I think those that are returning with epilepsy are just part of a broad spectrum of very serious issues these men and women are struggling with. So thank you for your question.
Thank you.
Yes.
Good morning. My name is Brian Smith, and I'm the chair of the Epilepsy Foundation. And I want to commend you also for a fantastic objective report that was long overdue. And on behalf of the over 50 affiliates that we have around the country that has been trying to represent patients from an advocacy and empowerment standpoint, this is a huge step forward. I'm also an epileptologist and a member of the AES and the American Academy of Neurology. And when we talk about collaborative efforts, I want to first note our colleagues at the American Epilepsy Society working with us over the past number of years, including our Public Policy Institute, which is happening this week, where we have patients and families going to Capitol Hill, and now all the organizations that have kind of stepped up and worked with us on the National Walk. So we do appreciate that very much. My question actually really rode on the similar area that Susan had mentioned, because as an epileptologist and being on the committee for the VA Centers of Excellence Epilepsy, when we look at that number from a clinician standpoint, there's this confusion about how we come to that number, because probably close to 50% of patients admitted to epilepsy monitoring units across the country end up having psychogenic non-epileptic seizures. The coding is so inconsistent, and even when we look at our VA centers, they talked about 30% range of that number. So I'm just wondering, can you give any further clarification on that? Again, I know where you got the number, but it seems like even there's more confusion on this whole PNES number, because we're just seeing the end of the road in epilepsy monitoring units, and there's really no concept of how frequent that problem is, yet it still falls under a seizure disorder diagnosis and category and coding.
Christy?
I can understand the struggle you're having with that number. Being a clinician, I hear you. It only stresses the point that we need ways to get at very clear definitions of epilepsy, not only with respect to how we manage patients clinically, but how we track and derive the appropriate numbers for how many patients are suffering with this disorder. We do not have adequate numbers, we don't have adequate definitions, and we don't have ways to track it right now. I think the committee spoke a lot about the possibility of improving surveillance, particularly with the fact that electronic health records will be quite useful going forward. The epilepsy community needs to have a voice in how electronic health records might play a role in surveillance in order to improve our understanding of those numbers. But at this point, we do not have a way to accurately track the numbers of patients that, that suffer from this disorder.
Thank you. I would just make one more comment. I want to thank you for the political push to get things moving, because collaborative efforts between the organizations are huge, and there have been political barriers in the past that we haven't been able to overcome. And I think you've really put an objective plan together that really gives no choice but for us to do that. So thank you.
Thank you.
Could I just add one more, by way of response to the figure issue? You know, we are debating this specific figure, but the reality is that whether it's 2.5, 3 million people that have epilepsy, or whether it's 140,000 or 150,000 new cases a year, it's still a very frequent neurological condition, ranked 4th in frequency behind Alzheimer's disease, migraine, and stroke, and yet it's one of the least understood conditions. So whatever the specific figure ends up to be, and we definitely need to get that, we still have, just from the data that we currently have, an idea of the frequency of it relative to the knowledge that we have about it.
I'm going to turn now to Lauren, who works with us at IOM, because we do have people on the line who have been watching this. And Lauren, do you have some questions from the field?
I do. I have some questions from the web. The first one comes from Danya Curry-Poor, who is a journalist writing for The Nation's Health. And she asks, how can the public health community best help this report, blueprint, roadmap become a reality?
Well, first, great question. And we are hoping with the partnership for both the public and private agencies who have been working on this, that we have a very specific plan for dissemination, and that we move forward with the public health community at their annual meetings, at their publications, and her help in doing this would be terrific. So if she would like to speak to any of us about some of the particulars, we are available today and would be delighted to talk with her. Any comments from my colleagues? Is there another question?
Just one more, and then I'll pass it to the other side of the room. This comes from Russell Derry, who is the Director of Education at the Epilepsy Foundation of Michigan. He asked, did your report address the issue of affordable access to all epilepsy medications, including brand name medications?
No. We did not address those particular issues in our report. It's more on the public health issues and other issues, and we did not talk about the biomedical or the coverage issues, as far as I remember.
Yeah, I think that we have a lot in there about access issues in general, and it includes access to issues discussed about medications and the issues of understanding, awareness, proper diagnosis, as well as affordability issues such as coverage and prices. But we do not speak to the issue. We lay out that as an issue, and one of the things that we do have is that with the work that the recommendations we've had about early diagnosis, about getting appropriate referrals for people to the right care at the right time, the issue of matching treatment to the high-risk populations. I think those are the sort of the marching orders to get us down the road toward a specific answer to that question.
Right. Christy?
In Chapter 9 of the report, we do list research priorities, and amongst those research priorities, the issue of understanding medications, brands versus generics, and access and value are addressed.
Thank you. I'm Cheryl Howd. I'm the chair of the North American Commission of the International League Against Epilepsy. And I also want to begin by echoing the sentiments that have been stated many times this morning. We really applaud your efforts and appreciate what this report will do. One of the strongest mandates of the North American Commission has been to improve and increase epilepsy education in North America and in the Americas overall. And to that end, we've obviously been focused on web-based education, which came up quite a bit in your presentation. Both AES and ILAE and many other organizations have had their own efforts. And the question I have for you is, does the committee have a perspective on what is already out there? Are there big gaps? And are there recommendations to how we can organize into one main internet-based educational effort?
Joan?
Speaking about education for professionals or for patients?
Really both.
Well, in regard to patients, you'll notice in the chapter on education, there's a lot of programs that are being developed. And the Centers for Disease Control has the Managing Epilepsy Well Network that they've developed programs for not only learning about epilepsy, but also dealing with some of the comorbidities. And I think that as those get further developed, we then need to disseminate them. But we're in the early stages, but there was encouraging information that they were working. So I'll end it there with the education for patients.
Good. Hi, I'm Tony Cuello, and I have epilepsy, and I've lived with epilepsy for the last 50 years. I want to thank you for a great report, because finally you're helping us to bring it out of the closet. As you indicate, that's one of our biggest issues, is that we're able to start talking about it, and that's critically important. Two questions. The first one being, Susan mentioned about veterans, and did you talk to the Veterans Administration? The VA hospitals do a lot of work in regards to veterans issues. It's not that coordinated, but they do a lot of work, and it would be interesting if you did talk to the Veterans Administration and AARP. Could you say that there's a big impact on the elderly?
Mr. Cuello, we want to thank you for being here with us today and your work on stigma and the work that you have done around this area. And I'm going to turn to Christy to answer the specific question you asked.
Thank you. With regard to veterans, in our public hearings, we did have representation from the VA Epilepsy Centers of Excellence. And so we did take into account what goes on there. With regard to AARP, I don't recall including them specifically in the discussions. Good idea.
We'll need to do that, I would think. The second thing, in regards
Before you
to...
hold on just a minute, because Chuck would like to say it.
I'd like to add on the data and surveillance part of the report. With respect to the VA, we made a data request to a number of different organizations to get us as best the latest information on incidence and prevalence and remission and prognosis, and the VA was one of them. And you can read in the back of the report a very detailed, pretty detailed statement about the recent data, and it's quite dramatic on incidence and prevalence of veterans from Afghanistan and the Iraqi wars. So that's there with the VA to get us started, at least on the data side. And with respect to older adults, again, on the data side, we have identified the older adults as definitely a focused population for us to get better data on incidence and prevalence. It's obviously a growing population, and with a high incidence and prevalence of epilepsy.
And the last thing I wanted to bring up in regards to stigma, young people, particularly those in high school or in college, going for jobs and so on, stigma is a huge issue. And I have a lot of young people who talk to me about the problem of thinking of marriage, thinking of jobs, and what that means, and the consequences of the stigma for them. And you reference that, but that's a huge issue for young people. And the reason we have to address that stigma issue is because these young people are faced with that all the time, and that is one of their top priorities. A lot of the things that we mentioned are issues for people of different ages, but for young people, that is a huge issue for them. So I really appreciate the job that you've done. Thank you.
Well, thank you for your leadership in this area, and I know that a number of our professional organizations will be having sessions and whole conferences devoted to stigma, and I think a lot to your leadership, and I know that Mrs. Rosalind Carter will be calling on you for help down at her in November for her stigma on, because I think there are many things in common with mental health and substance use and people with epilepsy. We can't keep in silos anymore. We really have to work together to address these issues, because again, it's ignorance and prejudice. Anyway.
Well, the concern that I have is that a lot of young people struggle with this and end up committing suicide and so forth. So it's a very emotional time for these young people and adjusting to the conditions around them. And so with epilepsy, this is a very, very serious issue. So I appreciate it.
Hi, I'm Brandy Parker, and I noticed that you guys touched a little bit on women's health as far as the pregnancy registry. Do you have some recommendations as far as how we can make sure that that happens? And what did you consult any other registries possibly out there for that?
We actually did quite a lot of research on what exists in women's health and epilepsy. There are registries out there. There are models in the UK and elsewhere in the world that we do comment on and talk about in the report. We were not able to analyze them beyond just being able to state that they exist at the moment and that there is data coming from them, and that's addressed in the surveillance chapter.
Thank you.
Hi, I'm Jones Klazacek. I'm the founder of Dravet.org. I'm here with my son, Nicholas, who has Dravet syndrome. And the question that I would like to ask is, beyond developing the sense of altruism and empathy that might reduce stigma regarding people who have epilepsy, in the process of creating this report, what did you conclude about why a typical American, my neighbor, my colleague, my other children's teachers should care about this report? Why is it important to them? What does epilepsy mean in terms of consequences for the broader community?
Good question. Joan?
That's a great question, and I think that it does. This report does an excellent job of really laying out how difficult it is to live with epilepsy on a day-to-day basis, because it's just so much more than seizures. It's all the comorbidities. So I think that it will introduce that it is on a spectrum, and that their experience with one person is very different than what the experience will be with others. So I'm hoping that it will educate the public to be more understanding of the spectrum of epilepsy. So thank you for that question. Thank you.
Yes, sir?
Hi, my name is Robert Moss. I am the co-founder of SeizureTracker.com, and I sit on the TS Alliance board. I have an 8-year-old with epilepsy. I find that we spend a majority of our time dealing with our school systems and educating them about how epilepsy has impacted his educational performance. He's fairly high functioning. I realize that we look at a broad spectrum of how epilepsy affects individuals, but I wonder, as you all ran through the report or worked through the report, did you look at the educational system and understand exactly how it's impacting our younger individuals that may be mainstreamed, and exactly how we had a great presentation by Dr. Herman at one of our workshops that really elicited a lot of information on educational impact. And I'm wondering, can you elaborate a little bit on how the committee went into that? Thank you.
Joan?
Thank you for your question. We looked at, with education, we looked at what you're talking about is both the impact on the quality of life of the family, because it's the family that's usually communicating with the school and trying to explain the condition. And we talked about how the cognitive problems that are associated with epilepsy may differ from some of the other learning problems, and that the schools are really not often set up with the regular testing that doesn't really cover the type of problem. So we have recommendations in there about needing more testing in school services. And we appreciated Dr. Herman's presentation. There's still not been many interventions on how to help the children in the schools. So we also have many research needs to really focus so that we really know more about it. Thank you.
Yes.
Hi, good morning. My name is Deanna McPherson, and I'm with the Health Resources and Service Administration. Again, I want to thank you, too. I think it's an excellent report. I think on behalf of HRSA, if I can speak for them, we were happy to be a part of the report. Just 2 comments. I think in the era of improving quality improvement and quality improvement efforts, I know that we're working strongly on that, and I was happy to see that as a part of the report. And I'm hoping that in going forward, that HHS will work to, all the federal agencies within, or under, I should say, HHS will work together more collaboratively, and on behalf of CDC too, that we can really not just have the report sit on a shelf, but actually take the recommendations and not just say we're partnering, but actually do something. So thank you.
Well, thank you all, and thank you for those comments, and for all of you who have joined with us this morning, and I'm going to turn it back to Lauren.
Okay, and I think that will conclude our briefing for today. As a reminder, you can find the report and related materials at www.nationalacademies.org and at www.iom.edu/epilepsy. I'd like to thank our committee again for joining us today and to thank everybody for being here.